A cancer diagnosis can be terrifying. It can turn a person's world upside down. Most of us know someone right now who is battling the disease or who has been lost. Today on Doctor's Care, we'll learn about the cancer patient journey, a commitment by CancerCare Manitoba to shorten waiting periods from suspicion to diagnosis and from diagnosis to treatment, recognizing that each day spent waiting can be frightening and stressful for the patient and for their families and friends. This commitment to re-engineering the patient journey is a first in Canada. CancerCare Manitoba has pledged to reduce the waiting, reduce the emotional distress, and to realize the dream of making the journey as painless and rapid as possible. Dr. Dolly Dhaliwal was the president and CEO of CancerCare Manitoba for 10 years. Dr. Dhaliwal has been instrumental in the initiative to re-engineer the patient journey. One of his concerns was that the length of time between suspicion of cancer and diagnosis was much too long, causing stress, worry, disturbing sleep, and significantly affecting a patient's daily life.
There's a very important outcome that I believe we need to pay a lot more attention to, and that's the patient's need to resolve that uncertainty. When a suspicion of cancer is raised, most patients are in shock and their life is put on hold until that uncertainty is resolved. When you put it all together, the journey from high suspicion of cancer to start of treatment can be inordinately long as I'm afraid to say 3 to 9 months. And clearly this is an issue for system managers like myself and physicians like myself. Obviously, the patient's need is what should dictate.
Bill Richards was a police officer serving in Fisher Branch in November 2010.
I thought I was suffering from a flu, and the flu got worse and worse and worse, and subsequently I drove to a hospital in Winnipeg.
Bill was quickly admitted, diagnosed with B-cell lymphoma, and had surgery.
I wound up at St. Boniface Hospital. And this was all within 3 weeks because non-Hodgkin's B-cell lymphoma is very fast-acting. By the time I was admitted to hospital at St. Boniface, I was basically told that I had less than 48 hours to live. And this would be very emotional. Yeah, it's tough. Anyway, long story short, by the time I was admitted to St. Boniface Hospital, I was very close to death, and they took immediate action there. And I was diagnosed very quickly. The care was phenomenal. No less than 6 doctors and specialists in oncology, specialists in heart, specialists in lung were at my bedside. And from there, the diagnosis was official.
Bill responded exceptionally well to his first round of chemotherapy and was transported to Bethesda Hospital in Steinbach to be closer to home.
And I underwent 8 rounds of R-CHOP chemotherapy with exceptional results. And here I am today. Yeah, it's an absolute miracle, but the miracle is in part from my willingness to want to live, obviously, and secondly, the absolute tremendous care, dedication, and professionalism shown by CancerCare Manitoba and all the professionals. I have 5 children, and they were exceptionally supportive, of course, throughout this whole process, and they are my pillars, right? The doctors were fantastic, support staff were fantastic, the nurses, absolutely phenomenal. I have nothing but positive. Manitoba healthcare is awesome.
It must feel a bit like a whole second life almost.
I'm in full remission. The strides that have been made in this disease. At one point, one of the oncologists at St. Boniface told me that probably a decade ago, I wouldn't be here.
We set out to try to look at the problem as a whole, and many other cancer agencies have focused on components of that journey, the time when you're ready to receive radiation to the start of the treatment, because the planning can take time. We're really interested on the beginning of the journey to the start of effective treatment. And once that is confirmed, then the patient becomes a cancer patient or patient with a cancer diagnosis. And that really increases, as you can imagine, the psychological temperature incredibly, and anxiety and worry. People cannot sleep, they cannot eat, they can't enjoy social events and so on, and will cancel holidays and weddings and all sorts of things because of the worry that this disease may progress. And we know that the earlier you treat in terms of the stage, the better the outcomes. Is in a way the imperative that should drive all healthcare workers, physicians, nurses, clerks, frontline staff, to try to resolve that uncertainty as rapidly as we can.
When Dennis was first diagnosed with cancer, he was living in Saskatchewan.
So when I was about 27 years old, I experienced rectal bleeding. And then, not knowing anything about anything, I figured, well, it doesn't hurt, it must be fine. So I probably bled for, I don't know. I mean, it could have been 6 months. I don't even know. I was newlywed, had been married for about 6 months, and was living in Regina, not my home. And something was happening inside me, and I had no idea what it was.
Ultimately, Dennis sought medical attention, and it was discovered he had a mass on his large intestine.
And we cried. And we cried.
While initially he was told he would have a colostomy bag for the rest of his life and would be rendered impotent, Dennis and his wife sought a second opinion. The second surgeon gave Dennis a different solution.
But you know what? Here's what I can tell you. None of this plumbing is growing back. I'm going to do my best to make sure that when I do this surgery, when we're done, you're going to be pretty much the same as you were when we started. I'm not planning on making any permanent reroutes. I'm not planning on pulling any nerves out. I'm planning on making sure that you, in your late 20s, are going to be okay.
Dennis and his wife went on to have 3 children and moved back to Manitoba. Then, in 2007, during routine testing, another mass was found. Dennis made the decision to have his entire large intestine removed at St. Boniface Hospital. His most significant memory after the operation was a visit from his surgeon, Dr. Cliff Yaffe.
I was so depressed, like I don't know, I said this about day 8. And I'm walking through the halls, and he didn't see me every day. He would come by every few days, or at least he didn't see me when I was awake every day. And I just remember the day, like he was there in the hospital, and I said, "Oh, Doc, this is just awful." And he puts his hand on my shoulder and says, "It's gonna be okay." And it's weird because because it wasn't medical. It was nothing but a guy who put his hand on my shoulder and said it was going to be okay. And it's interesting that now, 5 years later, that's one of the most significant things that I remember from being in the hospital. You can't underestimate the value of all these small things. There's all these doctors with all this specialized training. I got this surgeon with 30 years of experience, and he's an expert at all kinds of things. And yeah, he did a great job, and he opened me up and put me back together again, but the thing that I remember most was him putting his hand on my shoulder and telling me everything was going to be okay.
Through a combined effort of the regional health authorities, government, physicians, and specialists, it was agreed to a collective effort to shorten the patient journey.
And so we proposed a project that would aim to reduce that journey to less than 60 days for all patients. And I believe it can be achieved through coordinated actions of all care providers.
Dr. Cornelius Welk first began working with cancer patients over 25 years ago, when, after finishing his residency, he moved to the Mordenwinkler area. Dr. Welk and his team from Boundary Trails Hospital have played a key role in the improvement strategy for the CancerCare journey.
It was probably in about 2000, 2001 that we started really sensing that we had quite a large cancer population. It was growing, and they were having trouble accessing care initially. So we would diagnose a new cancer patient, and we weren't able to get them to see the specialist quickly enough. And then when we were able to get them in, they often came out with an order for more tests. And of course, you wait to see the specialist, you wait to see the tests, then you wait to see the specialist again about the results, and then you wait for your treatment, etc. And we said, this can't be happening. And so we looked at our own situation and said, how can we change this? One of my colleagues, Dr. Bob Menzies, and the nurse who was in charge of the department at the time, Cheryl Penner, and I worked at this project that we called the pre-referral project. So, as the name suggested, it had to do with seeing us or the nurse before the time of referral to Winnipeg.
The pre-referral project involved lining up all the patient's tests at the same time and developing a cohesive treatment plan.
My biggest mantra for a long time was that we needed to get concurrent waiting instead of consecutive waiting. If you're going to wait for 5 things, why do you have to wait for one before you can start waiting for the other? Let's wait for them at the same time. And eventually, I think that will shorten the cancer journey. It won't make it into days, but hopefully it'll make it into weeks.
This speeding up of the process, it obviously helps the patients getting into treatment more quickly, but does it also help the psychological aspects? Is it more one than the other?
That's a good question. The studies do show that people who have to wait longer don't have as good an outcome, but it's hard to quantify that in terms of days or exact weeks. We know that if you wait a number of months longer, your outcomes are going to be worse. But by far, the improvement is on the psychosocial aspects of things. The worry that people have is incredible. They describe to me their sweatiness and their just waiting in the clinic for somebody to come and tell them what the result is a time of great stress.
Not just for them, but for their families.
For everyone involved, that's exactly right.
The pre-referral program is now administered through nurse navigators, a specially trained registered nurse who becomes the patient's advocate, educator, care coordinator, and friend. Nurse navigators begin working with patients even before the diagnosis, when there is just a suspicion of cancer.
We are someone that they can come and talk to about the disease, about what the next steps are, and follow them along their journey through to seeing the physician in CancerCare Manitoba and preparing them for those visits, just giving them that support, information, Because at this point, the not knowing and that time frame of waiting is very stressful. And so we're there to be someone that they can call when they have questions and wondering why things aren't maybe done as quickly as they think they should be, and just give them that information. And then follow throughout their whole journey, whether it's now they're going to receive treatment, whether that be surgery, chemo, radiation, to survivorship, to palliative care, and then bereavement for the family as well.
Well, all of those roles.
All of those roles, yes. We've had people that have had their oncologist visits on tape and have brought those in and say, okay, what does all this mean? So you sit and listen to the tape with them and explain that information that's on there.
We hear people say, how could you have ever done this before without a navigator?
Cindy Funk is a psychosocial oncology clinician. This is a relatively new but important position in the cancer navigation team.
My job entails a lot of time with the actual cancer patients, so often I get referrals from nurses or from the doctors, sometimes self-referrals, but most of the referrals are to come alongside the patients and help them with emotional struggles that they have. There might be fears and anxieties. There could just be stress involved with all the things that are going on. So I provide some of that emotional support, as well as some more practical supports like financial. There's often financial difficulties.
I imagine that most people don't necessarily think of the financial burdens that diagnosis of cancer can do for you.
Very true. They're caught off guard by that sometimes. You know, it starts out by having to take time off to go to appointments, and then when they're actually in treatment, most of them are not able to work. So depending on what kind of work they've been doing and what kind of insurance they have at work, the needs can be pretty tremendous.
Clinicians will also provide emotional counseling.
I am also a person who's gone through cancer myself, so I have experienced that journey as well. So combine the life experience and the training, and that puts me in the place to walk alongside cancer patients and help them through their journey.
In October 2010, Ruth's daughter Caitlin began feeling unwell. Ruth took her in to see the doctor right away.
We stayed here a couple of days. We stayed here till Tuesday, and then we were taken to Winnipeg by ambulance. And then from there, it just unraveled very, very quickly. We all of a sudden ended up at ICU in Winnipeg because they just couldn't figure it out, what was going on. And then the tests started going more progressively. And finally, on November 2nd, we were given the diagnosis.
Caitlin was placed on an aggressive program that required heavy chemotherapy treatments. After 7 weeks, she was able to leave Winnipeg to continue the treatments at Boundary Trails. Caitlin went to school and was able to participate in swimming, which was an important part of her life. But the shadow of cancer never left the family.
A type of a sarcoma. It's aggressive, but we knew that it was virtually gone when we had done our scans in February. Then we had gone in, every 3 months they were saying it was good in Winnipeg. But we had done one in March of 2012, March 1st. Everything was good. They said everything was clean. Go live life. So we did. March 25th, I think it was, approximately. It was spring break. It all came back, and very quickly. She didn't want to be in hospital, so we just came here for checkups. Or the doctor would come to our house, which was great, and we didn't have to uproot her. She wanted to be at home. Dr. Corny Welk became her primary physician, and we didn't have to go to Winnipeg, which was something she absolutely, vehemently did not want to do again. She wanted to be at home. She was the bravest, the bravest person I know. She decided that When she was in hospital getting her central line in, she said to me, you know, Mom, I need to do something and I need to make it right. I need to help other kids. And so she started her own charity, and she called it Katie Cares. We give out bags to every child that is admitted into hospital, and those bags are called Katie Cares bags, and in there is a toothbrush, a coloring book, crayons or markers, and in each bag is a teddy bear. She felt that was a key component to this, and so that was another thing that she did. We have big goals, we have big dreams for this charity, and we're working towards those. She gave us a clear mandate as to how to do this and where to go. She had a vision that surpassed anything that I could think of, but she saw so much more.
The oncology clinic at the Steinbach Hospital means that patients from the surrounding area can receive their chemotherapy treatments without having to journey to Winnipeg. In addition to her family practice at the Steinbach Clinic, Dr. Karen Taves is one of the physicians who oversees patient treatment at the CancerCare Clinic.
We get all our referrals from CancerCare Manitoba. If a patient from our area is diagnosed with cancer, they are then referred to CancerCare Manitoba. They see an oncologist there who then prescribes the chemotherapy. And then if they're from this area, then they're sent back to us, referred to us to provide the chemotherapy. So myself, as well as with our team of nurses, we administer the chemotherapy, we manage the side effects, we see them in follow-up as well. And we all work together as a team.
With the success of the navigation program at Boundary Trails, Bethesda is moving in a similar direction.
We're very excited about that because often if somebody is having a suspicion of cancer in the community, we have never been involved, but with this new initiative, we'll have some more resources to get involved with that, and perhaps getting involved in the diagnosis and even before they are prescribed chemotherapy. So it's a little bit of a different slant on what we've been doing all along.
In the spring of 2013, Gord Topnik was diagnosed with leukemia. Gord comes to the Bethesda Clinic twice a week for chemotherapy.
Well, you have your good days and your bad days. When I'm in here 2 days for chemo, then of course I don't feel that bad after I come home. It's usually the after effects, which is usually anywhere starting right there after the next day and runs up to Saturday, even, where you feel dizzy, you feel nauseous, you just don't feel good. I'm here at 8 in the morning usually, and then I get out of here by 4:30. It's just a very, very slow drip. They've tried it a little faster a few times, but then I started getting pain again, so then they have to slow it down. So I think the nurses are doing a real good job here, and they're got it on top of it now that they know exactly how much they can give me. So.
Gord's oncologist, Dr. Johnson, is pleased with his progress and says with his general good health and the treatment he's receiving, Gord's prognosis is optimistic.
Well, he said to me, he says, your health is actually fairly decent, he says, and I can give you another 10 years. So, cross my fingers, right?
Lorna Boucher was diagnosed with breast cancer in July 2009.
You can't believe, it's happening to you. You hear of other people having it, and then all of a sudden you get it. It's very, very shocking.
Lorna had a lumpectomy and was being carefully monitored to ensure no new lumps appeared. Then, in November 2011, her son was killed in a tragic car crash.
right after that, that's when I was told that the cancer had spread into my bones. So there was a lot of things I had to deal with. I still haven't come to terms with the passing of my son. But I think if you have a positive attitude, a positive outlook on life, you have a lot of friends around you, I mean, it's fantastic. You can keep going, you know, but it's been a long journey for me. I've looked online, and the expectancy to live is anywhere from 2 to 5 years. But I'm not ready to go yet. I've got lots of things to do, lots of things. I would like to go and travel.
Where would you like to go?
Hawaii. I would love to go to Hawaii. Hawaii, Disneyland, you know, fun things. No, I have a very good outlook. Like I said, I just take it as it comes.
CancerCare Manitoba Foundation does a lot of risk awareness, and we haven't talked about that aspect, which is trying to reduce our risks of cancer, because we don't want to be diagnosing and treating cancer. Ultimately, the real effort is trying to prevent and detect cancer early. So we have screening programs, and still not all people make use of it. And so it's a challenge. There are many challenges. I'd particularly like to emphasize that there is much that all of us individually and collectively can do to reduce the risk of cancer. Take exercise. There is new and emerging evidence that it can reduce the risk of developing cancer by 30%. 30%. If we had a pill that did this and it cost thousands of dollars, we'd all be screaming for that pill. And yet, it is something that is within our control. So I would literally urge every Manitoban to be as active as they can. And it'd be wonderful to say, Manitoba has the most highly active population in the country.
That would make you happy.
Yes, that would be absolutely wonderful.
As a cancer survivor, I know that one of the best ways to ensure a good result if you end up getting colon cancer is to catch it early. One of CancerCare's initiatives is to send out FOBT kits, which allow you to do a self-test that you send back to them so that they can screen you for blood in your stool. This is a good preliminary way to check to see whether or not you've got colon cancer growing, and a good way to catch things early. If you get one in the mail, then follow the instructions, send the kit back in again, and that's all you have to do.
You must look back on this initiative to shorten the patient journey and feel a sense of pride. It's such a significant impact.
We have yet to achieve that target, but to have been part of the solution and part of at least the energy to begin that transformation is a privilege.